We begin tonight with positive news in the fight against Ebola. Researchers in Uganda have launched a new trial for an Ebola vaccine. 800 health workers involved in the fight against the deadly virus are receiving doses of the two-part vaccine. Halima Athumani reports from Barara in western Uganda.
Researchers in Uganda said the new Ebola vaccine trial will take 2 years to complete. Dr. Juliet Mwanga, director of the Barara Research Center, says the vaccine combines antigens, a substance that induces an immune response in the body, from the Ebola virus, a common adenovirus, and the Yersinia Ankara vaccine. It's manufactured by the US-based Johnson & Johnson company.
This J&J vaccine aims at prevention, so it's primary prevention before you have contact at all. Yes, and the other difference, as I said, it has two parts. So you're given the first dose, and 56 days later you get another dose, which boosts your immunity. So hopefully it works for a longer time.
Currently, Uganda is using an Ebola vaccine by the Merck pharmaceutical company, but Mwanga says they need to try out new vaccines too. Uganda's move is motivated by its proximity to the Democratic Republic of Congo, where more than 1,800 people have died from the Ebola virus since August 2018. The new trial targets 800 health workers and frontline support workers who meet a few basic requirements.
Someone has to be 18 years and over. Then, of course, they have to be able to sign informed consent. Then they must not have been vaccinated with Ebola before, or they must not have suffered from Ebola before.
The researchers are hopeful the vaccine, if effective, will help Uganda and neighboring countries that have suffered through Ebola outbreaks. Uganda has seen no new cases of Ebola in recent weeks, but health officials have been on high alert since June when 2 adults and a 5-year-old boy who had crossed into Uganda from the DRC died of the virus. Halima Athumani for VOA News, Barara, Uganda.